I could not get images to upload into Coach's Eye. However, we are looking at the anterior view of the double limb weight-bearing stance. This is showing us that the left patella is positioned slightly more medial and inferior when compared to the right knee. Now we are looking at the posterior view. There seems to be a slight internal rotation of the femur. The popliteal fossa seems to be symmetrical on both sides. And when looking at this posterior view, the position of the left foot is noted, and the foot seems to be slightly more internally rotated, and there's no valgus, varus, or recurvatum that is observed. In the anterior view, during the single leg stance, the TPC stayed in alignment. However, there is a slight lean to the left when lifting the right leg. So in this rectangle, we're going to watch this hip. When I lift that right leg, you kind of see that hip pop out to that left side. In this specific single leg stance with that right leg lifting up, you can kind of see my upper extremity crunch forward. That could be my pelvis actually rotating. Continuing forward, in the anterior view again, that transition from single leg to double leg is even on both sides. So if we watch a couple, it is fairly even. When transitioning to weight bearing on the left side, the patella moves medially and then corrects to a neutral position, and the center of gravity shifts slightly to the left when balancing. So we will zoom in on this left knee. So right there you can kind of see the patella shift medial when adding weight, and then right here is where it shifts back to neutral. Next, we're going to be looking at the height difference in the stance. So I drew a blue line, and I actually don't notice any increases during movement, so we can see that the shoulders are pretty aligned under that line. Taking a look at our foot tripod during weight bearing, it looks like the weight is pretty evenly distributed on both feet. On this one, you kind of see a little toe raise, but once I'm in position, it stays normal. And actually in this position, you can, and if we rewind a little bit, you can see that when I lift up, this foot rotates out, which could be indicative of a tibial torsion. Next, we're going to be looking at the posterior view of that single leg stance. During this, you can kind of see that the TPC is overall in alignment. When shifting or when transitioning to weight bearing on the left side, the femur internally rotates and the knee flexes, and there is no lockout of the knee when balancing. So we'll go ahead and zoom in, and we can kind of see already when standing, this leg pops back, and this right leg pops back, and then this left leg does not necessarily get that. And then when transitioning, that knee stays flexed. That femur internally rotates. So you can see that shift right here. And there's no lockout of that knee. Again, looking at any height shifting, there's no subtle increase. So if we switch, I stay right in line with that blue line. In the foot tripod, there are a few notable observations. From the posterior view, it is noted that the arch slightly collapses when going into that single leg balance. So here we'll look at that left foot again. Right there you can see everything just drop, and that lateral foot lifts up off the ground. Another thing to make note of is my hip alignment. And I'm not sure if that's just where my hands were placed, but when I lift up that right leg, you can kind of see a shift. In the anterior view of the single leg squat, we are going to be looking at the left side again. I don't think my TPC is very aligned. As I squat, you can see that I shift over to this side. So I stand up I am already there, but you can see my entire body just shift over to that left. You could argue that when I was balanced up top, my TPC was in alignment, but as soon as I started moving, it shifted. When going down into the squat, we can note that that patella moves medially and my whole knee kind of caves in once I hit my bottom, the deepest part of my squat. We can take note and say that the tibia internally rotates. So if we watch when I squat, right there would be when it would rotate, kind of when I lose balance. So we'll do another one right there again, which could be a reason why my knee is having a valgus force. When looking at the foot tripod, there is some lifting of the toes, so you can watch. There's some rolling to gain balance, as well as, so there's that rolling again, and then if we go to the next one, there's that big toe lifting up. And then, of course, we can note my upper body having to use my arms to maintain balance. Next, we'll be looking at the posterior view. So I'm going to play this, and as we go through, we notice that the TPC was in alignment for this first squat, but not for the last two squats. So this right there, out of line. And then this last one, kind of that shift right there, out of line. Next, we're going to be looking closely at that left knee when I go down into the squat. It's a little difficult to tell just because of how far down I go, but you can assume that my knee caves in, and you can kind of see that hip shift too there. But you can see when looking that medial aspect that it kind of shifts right into that, along with my arch dropping. The foot tripod seems a little unbalanced, so you can see it when I'm standing here, it's all distributed, but once I start moving in my squat, it looks like maybe that medial aspect of my heel, my great toe take most of my force, and then when I stand up, I have to shift my foot, and then again when going down, that medial aspect of my heel and my great toe. And then again right here, you could kind of see that great toe lift up as I lost balance. When coming up from the squat, we are actually able to notice some extension here, which was not noted pre-assessment. So again, we're going to squat and notice that extension and knee locking out. No other asymmetries were observed. Lastly, we're going to be looking at the lateral view. So right now you can see that my TPC is aligned. And as I begin squatting, it appears to still be aligned, other than just that forward leaning and rolling of the shoulders to get back up. When squatting on this first squat, you can note that that left knee caves in right there, which would be some tibial internal rotation. Here we can zoom in. So we're going down, and right there you can just see it cave in. In regards to the foot tripod, if we look at this foot when standing, it looks like this lateral aspect of my foot is not maintaining much weight. And then as I start squatting down, a little bit is shifted, and then once I get further, it lifts up. So right there, my pinky toe and the lateral part of my foot. So off the ground, and then as I come up, weight is distributed. Other things that were noted is the great amount of perineal firing. So right there, you can see huge muscle definition, all right in there. And then again, down here, we get some tibialis anterior firing. So it's flat right now, and then as soon as I start squatting, right there, fired up. Overall, the squat was not terrible, but there are no other observations noted.